Hi everyone, I'm Dr. Arshad from Brooke Surgery, and thank you for tuning in today's video. Today is on blood pressure and the risks of blood pressure. So how's everyone doing? Bear in mind that we're accepting live questions as we go along, and we'll endeavour to get answer those questions as we go through this video. And if for any questions we can't answer during this live video, we'll try to answer within 24 hours. So today's video, as mentioned, is about blood pressure. And we're going to talk about this in some detail and give you an idea of how we can try and combat this. So high blood pressure is a condition that is very rarely has noticeable symptoms. So you may have high blood pressure without even realizing. 30% of the adults in the UK have high blood pressure and actually may not realize this. But if the condition is left untreated, you do have an increased risk of serious problems such as strokes and heart attacks. So it is an important topic that we discuss today. What is high blood pressure? So blood pressure is measured or recorded with two numbers. The higher number is the force by which your heart pumps blood around the body, whilst the lower number is the resistance to the blood flow in your blood vessels. So you'll often see this on your blood pressure machine as two numbers. Now, a relative simple way to try and make sense of these numbers is to think of blood pressure as pressure building up within pipes. If the pressure is too high, bad things are likely to happen. So, and a general guide about blood pressure and what kind of figures we're looking for. Anything over 140/90 is considered to be high. And those who are over 80 years old, these figures are normally a bit higher, around 150/90. Now, some people who have conditions such as diabetes or kidney problems, their blood pressures are generally need to be a bit lower. Now, ideally, blood pressure is usually considered between 90/60 to 120/80. Though saying this, everyone's blood pressure is slightly different. What may be considered low or high for you may be normal for someone else. Now, unfortunately, the only way to find out if you have high blood pressure or what your blood pressure may be is to actually have your blood pressure checked. Now, checking your blood pressure. So let's talk about this. All adults over 40 are advised to have the blood pressure checked at least every 5 years. Now, you're able to do this at a number of places. You can do it at the pharmacy, even some workplaces. But in view of changes with COVID, it's worth thinking about buying your own blood pressure monitor so you can have your blood pressure checked at home. You can normally pick these up online or even from some pharmacies for about £20. That way you never have to leave your house for an appointment to get your blood pressure checked. At the Brooke Surgery, we have patients that take this on board and we do a home blood pressure monitoring for over 7 days. We send you a web link, which you submit your blood pressure readings. It does an average for this automatically, and then the results come through to us. And then based on your result, we then offer you a management plan catered around your lifestyle and your needs. Now, patients at the Brooke Surgery know that we have a new system here, online system, where you get a 7-day appointment. There's no queues. You don't have to phone up. And we are actually welcoming new patients at the Brooke Surgery. So if you do want to sign up and switch, you can find our link on our website, which is www.brooksurgery.co.uk. So talking about the risk of high blood pressure now. So as mentioned, you might not get the symptoms, but what can it do to you? So if your blood pressure is high, you can put more strain on your blood vessels, your heart and your other organs, such as your brain, your kidneys, or even your eyes. Now, having high blood pressure for long periods can even increase your risk of life-threatening conditions such as heart attacks, strokes, heart failure, kidney problems such as kidney disease, and even things like dementia. And if you currently have high blood pressure, reducing your blood pressure, even a small amount, can have a big impact on these life-threatening conditions and reduce your chances of having them occurring in the first place. So let's talk about the causes of high blood pressure. It's not always clear what causes high blood pressure, but certain things can increase your risk. So let's talk about that. What we do know is that you are at an increased risk of high blood pressure if you're over the age of 65, and if you're overweight, those who are of African or Caribbean descent are at higher risk. If you have a relative with a high blood pressure, if you eat too much salt or do not eat enough fruit and veg, you don't do enough exercise, you drink too much alcohol, or even coffee or caffeine-based drinks such as Red Bull or things along those lines, if you smoke, or if you do not get much sleep or have disturbed sleep. So there's a number of risk factors here that can contribute to your blood pressure, and few or more of these might apply to yourselves. So making healthy lifestyle changes can significantly reduce your chance of getting high blood pressure in the first place, or reduce your blood pressure if it's already high. So let's talk about some of these lifestyle changes. So if you reduce the amount of salt that you eat and have a generally healthy diet, that's a positive move. Cutting back on alcohol, and similar with caffeine-based drinks. If you are overweight, trying to achieve losing weight is a very positive effect on your blood pressure. And exercising regularly as well. So, you can do about 150 minutes worth of exercise that get your heart rate up. Walking is good, but doing something that gets your heart rate up regularly is going to be more beneficial for your heart and your blood pressure. As mentioned, cutting back on your caffeine and stopping smoking is a big factor as well. So doing some or even all of these lifestyle changes can make a big difference in reducing your blood pressure. But if they don't do the trick, there are medicines that we can give you to reduce your blood pressure even lower. Now, when it comes to blood pressure medicines, it's not always quite one size fits all. What might be best for one person might not work for the others. So often you might hear of a friend or a relative that's on a blood pressure medication, but when you get started on one, it might be something different. That's because each plan is tailored to the patient we have in front of us. So sometimes some people with high blood pressure might need to take one or even more medicines, depending on what the blood pressure looks like. But this would need to be discussed with your doctor. So as an overview, blood pressure is a silent condition. You may not have symptoms of the blood pressure, but we talked about the risk factors that can predispose you to high blood pressure and some of the consequences, some of the life-threatening conditions that you can have. And also it's worthwhile bearing in mind the lifestyle changes that we talked about, alcohol, exercise, losing weight, living a generally healthy lifestyle. If any of our Brooke Surgery patients have any questions and you haven't had a chance to submit it here, please do so. And actually, we welcome questions for anyone here on our Facebook page. And I'll see what questions we have on our page here to see what we can go through here. So it says here, if I start taking blood pressure tablets, will I be on them forever? It's a really good question, actually. It all depends on what your personal situation is. Unfortunately, very rarely does a blood pressure have a cure per se. A great majority of people need lifelong therapy for the blood pressure, as by the time they notice they have a high blood pressure, they may have already had it for years, which is why it's important to stay on top of it quite early. And so, if you were to take on board some of the lifestyle measures and you, for instance, you were overweight and you were able to lose weight, there is a possibility you could come off the blood pressure medication as a general rule. I've got another question here. It says here, what time should I take my blood pressure? Okay, so ideally, carry out your home blood pressure readings at a variety of times throughout the day to get a good representation of your blood pressure during the normal daily life. The reason we say this is because your blood pressure will fluctuate throughout the day. So, if you're feeling a bit stressed or if it's a different time of the day, your blood pressure might be higher or lower compared to other times. So what we normally advise is take it over the day a couple of times. We normally say twice in the morning, twice in the evening, and then get an average over 7 days to get a true picture of how your blood pressure affects you. And also one thing worth mentioning is, which actually is linked in with the next question. So the question is white coat syndrome a real thing? Because my blood pressure always jumps when the doctors check it. It's a good question. We had this a lot, and yes, it is a real thing. We find it extremely common for people to have higher blood pressure when we take them in surgery rather than it would be at home. So this is why, as mentioned earlier, we advise you to get a blood pressure monitor for you to take at home when you are more relaxed and it's more likely to be an accurate representation of your blood pressure, and therefore you're less likely to have a high reading. So, it's quite a few things to take from this talk. And one of them would be, getting your own blood pressure monitor, which is very useful to help looking after yourself, looking after your family's health. And you can find a number of them online on places like Amazon, or even inquire at your local pharmacy. So if you have any other questions, let us know. So anyone at the Brooke Surgery, just send it through our online system and we'll get back to you. You can send a request anytime and we'll get back to you within working hours. And those who are not patients here, we are accepting new patients, so you're more than welcome to sign up and switch and to benefit from our new service here. So thank you again for your time, and tune in next week for our next topic. Thank you.